everyone, hi, my name is Sarah. Welcome to my YouTube channel. Yes, you won't believe it, but this is my first video, my first presentation for my channel. I just wanted to start this, so I hope that you'll be able to rate me and tell me how I performed with the presentation, right? So I want to welcome you all on board. Welcome. Don't forget to like the video. You can comment, you can share your ideas, tell me whatever it is that you want me to also talk about. Yes, you can share your knowledge as well. We are all learning, so all your ideas, your comments, your suggestions are welcome. You are free to also share, and most importantly, I would like you to subscribe so that you get notifications in case I do a new present. Great, so let's get going. It's about time so that we can all get out of here quick. So today I'm presenting on danger signs in pregnancy. Yes, I mean danger signs are happenings that put you and your pregnancy at a risk. Let's say they are the normal discomforts that we experience day to day during pregnancy. Yes, definitely during the pregnancy we'll find ourselves experiencing some signs, but they should be normal discomforts. During our daily activities, we will experience some discomforts within the pregnancy because now we have a fetus growing within us. However, when these normal discomforts that we experience from our day to day becomes excessive, such that it prevents us from going about our normal daily activities, then we term it as a danger sign. So danger signs are happenings or things that put you at risk, put you and your pregnancy at risk of a mishap. We say there is danger ahead. Yes, and I'm saying that it is so when the normal discomforts that you experience, I mean the normal headaches, the vomiting, the abdominal cramps, the swellings, and what have you, you experience them, but then they become excessive. That is when we term it as a danger sign, and that is when it prompts us to get quick attention, to give it much more attention. Yeah, just so you know that, I mean, we are at risk of something, we are at risk of developing something. So it is just a sign, symptoms that are telling you that there's danger ahead, there's an unpleasant happening ahead, and so it demands your utmost attention. So I hope you understand what danger signs are and how to differentiate between a danger sign and a normal discomfort. So I'm going to mention the danger signs one after the other. Great, and then give some explanations to it. I hope it helps all of us. So we have excessive vomiting. Yeah, normally some of us experience vomiting on a normal basis, salivations and whatever. But when it becomes excessive, such that every second, every minute, you are throwing up. I mean, you wake up from bed, the first second of waking up, you are throwing up. You just move from the bedroom to the hall, you are throwing up. From hall to kitchen, you are throwing up. From here to here, you are throwing up. It is interrupting your normal daily activity, and that is excessive, meaning that you have to give that an attention. I hope you get it. We have excessive headaches. On a normal note, you experience headaches, but then it shouldn't prevent you again from doing your normal daily activities. We also have excessive swelling of the face, the hands and the feet. We term this edema. Now when this happens, with resting, checking of your blood pressure, keeping up with your doctor's appointment, this should be subsiding gradually. But some of us find it, I mean, increasing rather than going down and down. So we would have to get checked on this note. It's also a danger sign. Then bleeding, even if it's just a spot, okay? Even if it's just a spot of blood that you find in your panty or undergarments, let me say that with your undergarments, then it is a danger sign. Some of us may experience bleeding or spotting right after sexual activity in pregnancy, and a whole lot. Bleeding is an emergency. I mean, bleeding is already red, so let's get going. And when we see a blood spot, we have paleness and dizziness. Yeah, so paleness and dizziness come handy. I mean, mostly when you are at home, try and look at your skin and then your mucous membranes, your eyes, look at your palms, observe yourself in the mirror. There may be signs of anemia in pregnancy, so when you notice any of those things, it may be a prompting that you are experiencing such paleness, you are moving into that. Dizziness, again, moving into that. And that is why there is a need to always check your HBs and other stuff. So there are also danger signs in pregnancy, and we should be on the lookout for them from time to time. We have abdominal cramps, which is excessive abdominal cramps. I said it shouldn't prevent you from doing your normal daily activity. Now, abdominal cramps are going to come on a normal note. However, it shouldn't be excessive such that you can't even rest. Yes, that means that you have to rush to the hospital care. We also have water breaking when you are not at 10. Now, normally there's the cervix, which is the gateway to the uterus. There's a mucus plug in this cervix to keep all the contents of conception. When I say the contents of conception, I'm talking about the fetus, the amniotic fluid or the lipoamnion, the placenta, and all its related membranes. Now, there's a membrane that baby lies in. Okay, yes. Now, this soft membrane is what contains the lipoamnion and what have you. Now, this is just a covering. A membrane is just soft tissues that have come together to form something. Okay, yeah, so that is it. Now, this membrane that baby is lying in together with the lipoamnion can break off. Should only break off when you are at 10. All right, so when you see that this mucus plug, water has broken and then everything is coming out, then it means that there's a danger ahead and you have to go to the facility for care. Simply means that you'll be losing lipo, and then baby is at risk as well as yourself. So immediately you experience water breaking, if you are not at 10, it is a danger sign and then you have to come. How do you differentiate this water from normal water? Now, it's not normal water, it's warm, it's slimy, it's a bit creamy. Yeah, so you will see it's streaks. It doesn't flow so much. It's a little bit viscous than normal water. So you definitely get to tell the difference. So when this is supposed to only break when you are at 10. When I say at 10, I'm referring to weeks like 37, 38, and what have you. Before those weeks, some of us may be at 10 just at 36 weeks. That's fine. But then if you experience your water breaking at 35 weeks, 34 weeks, 28 and the rest, they are all danger signs and you should get care. You should give it your maximum attention. I hope you get it right. Great. We also have not feeling your baby's movements. Now we'll start feeling baby movements after about 16, 17, 18, 19, 20 weeks and on and on and on. Now at every point in time, every mother is supposed to feel baby's movements at these weeks onwards. Great. So if you do not feel your baby's movements, do not wait. It is an emergency. It's a thing. At every time, you should be able to feel your baby moving and kicking. Okay? Yes. If you do not feel baby's movements, please do not wait. Alright? Give it your maximum attention. We have high body temperatures, which may also be an indication for other medical conditions like having malaria and the likes in pregnancy. So the moment you experience that, you still definitely have to come to the facility for care. Alright. It is also most appropriate if you have thermometers with you, because we just cannot check with our palms that we are having high body temperature. However, if we have our thermometers, we could tell temperature of 38, 40 degrees, they are high. Then we could go to our facilities for care. Then we have vaginal discharge, which is in the abnormal sense. So abnormal vaginal discharges are also parts of the danger signs in pregnancy. Now, during pregnancy, we will definitely experience vaginal discharges in a copious amount. However, it shouldn't come with itching, color, odor, and what have you. Then it shouldn't be too copious such that we can't even do anything to ourselves. So we have to check that. Now, it is because of estrogen cells, okay, that are causing the endometrium. Hey, did I say endometrium? Sorry. The cells of the vagina to shed off. That is why we may be experiencing vaginal discharges in the abnormal sense. But it shouldn't be excess. It shouldn't have smells. It shouldn't have itching and what have you. It shouldn't have a color. So if it does with any of these, we term it as an abnormal vaginal discharge. I hope you get. So an abnormal vaginal discharge is a discharge that is coming with an odor, an itch, and a color. If you experience any of these, color as yellow or green, you should come to the facility for care. And the last thing I would like to talk about is convulsions. Yeah, convulsions are also a thing in pregnancy, and it's also termed as a danger sign. Convulsions are just quick movements, shaking and all that. Some of us may experience that because of stress and other stuff. Now the moment you see that, you have to quickly run to the facility. So what do you do when you experience any of the danger signs in pregnancy that I have spoken about? All that you need to do is to go to the facility of your choice, whichever facility is caring for you, whichever facility you prefer, whichever accredited facility you can go and watch and get care. Yes, it is because we do not manage danger signs at home. So whenever you experience a danger sign, be on the lookout. I always advise, be on the lookout. I mean, know the difference between a normal discomfort and then an abnormal one, an excessive one. And then when you experience the danger sign, move to the facility, get support, get a support person, and then kindly go to the facility, visit the facility of your choice for care. We do not manage danger signs at home. Again, take note. So don't be at home and just be calling only your doctor and midwife and be waiting to reach them in case they are busy and you are not reaching them. Quickly know these signs and then move to the facility of your choice. There are always health professionals to care for you. Alright. Thank you very much for joining in. I hope I did well. Great. Thank you so much. I hope to come your way with another exciting lesson presentation. Bye.